The things that really are associated with side effects from prednisone are the daily prednisone dose and then the duration of therapy. So the higher doses you're on and the longer amount of time that you're on the prednisone, the more likelihood you have of developing a lot of the different side effects associated with prednisone use. A lot of them, luckily, are partially reversible as you come off the dose of prednisone and as we replace it with other medications. But cataracts, some of the bone effects, and then the cardiac side effects can be longer lasting. Overall, we have significantly less side effects if you can get people on doses less than 10 milligrams a day. So these are some of the side effects that you guys have seen or are familiar with. I know there was another talk on prednisone and some of the side effects. So skin, you can get the steroid-associated acne. You can get some hair loss on the top of your head, more hair growth in other areas, bruising, right, skin thinning. And a lot of these features luckily do improve as the steroids are lowered, but they still affect your quality of life, and there's still something that you might be concerned about. Obviously, with some of the extra hair growth, there's hair removal creams, there's topical acne medications. Even though you do have some thinning of the capillaries with increased bruising on your arms and legs maybe, from like a small bump that you didn't even know happened, patients will come in and have sort of this just really thin, easy breakable skin. It will improve as your prednisone dose is lowered, but the good thing to know about it, it doesn't signify an increased risk of internal bleeding. So just because you're having those sort of lesions on the hands and sort of superficial areas, it doesn't mean that you have an increased risk of bleeding into your organs or anything like that. Peptic ulcer disease, a lot of people will have some stomach upset and irritation when they're taking prednisone, so you can take it with food. Especially if you're taking anti-inflammatories like NSAIDs, so ibuprofen, Aleve, something like that. If you're taking that for pain control and you're also taking prednisone, you actually have a 2 times higher risk of getting peptic ulcer disease or gastritis. So you want to protect your stomach. So you can ask your doctor either to prescribe you like a Protonix or a Nexium or some sort of stomach protection, and make sure you take it with food. Other effects include sort of mental status changes, so you can get hypomanic in 30%, depression in 10%. You can have some memory loss, psychosis, so these are all different side effects that can happen with variable doses of prednisone. And then prednisone can affect your bones, which we all know, and a lot of your docs will talk to you about bone protection. Some of the way that it does this, bones are constantly in a state of turnover, but there's two main cells that are sort of building up and then destroying your bones, and this is constantly happening in everybody. But when you get outside, when steroids are given to you, basically the cells that are responsible for building up your bones are inhibited. They're kind of shut off a lot, and the bones that are responsible for, or the cells that are the osteoclasts, which is the other one up there, those are the ones that are responsible for eating away and sort of eating away at the bones. And like I said, usually they're in a really nice balance where they kind of are constantly eating away bone and developing new bone. But because of the steroids, it's shifted, and so you get a lot more bone loss and a lot less bone development, which leads to a lot of the osteoporosis and worrisome long-term side effects with being on prednisone. You have less calcium absorption, you get rid of more calcium, and like I said, the cell shift is off, so you have more bone resorption and less bone formation. So things that we will try to give you to try to prevent some of those side effects include calcium and vitamin D. If your vitamin D is really low, we'll give you the weekly dosing, that high dose one. But calcium and vitamin D can be supplemented when you're on prednisone, especially above 20 milligrams a day. And then in terms of just long-term monitoring, you want to get a bone density scan, especially if you have risk factors for osteoporosis, within 6 months of starting the steroids, to try to see if you need to be on a medication really to prevent your bone health long-term. Other effects, and I'll be moving on for prednisone shortly, obviously cardiac effects, so elevated blood pressure, weight gain, elevated blood sugars. So even patients on less than 10 milligrams a day have almost 2 times increased risk of needing to be on a diabetic medication. So while you're on steroids, obviously trying to do things like, watch your diet, it can make people more hungry. So it's hard to say, watch your diet and you're more hungry and you're taking this medicine that's making you feel that way and making you like hold on to more water and feel bloated. So it's difficult, but trying to stay within those healthier eating habits will help when you sort of decrease the dose of prednisone to be able to get back closer to your baseline. And then, of course, infection. So there's always higher risk of infection with prednisone and with all of the medications that we use. Again, this doesn't mean that you can't go visit, go to a grade school play or go on a flight or do anything like that. You just have to take standard precautions. So, keep the hand sanitizer stuff with you. Like, make those decisions just so that way you can minimize your risk, but you don't have to change your entire life. You can still go do visit your relatives, do whatever you need to do. But just if you know that there is someone sick, don't maybe wait a couple days before you go see them until they start feeling better, because you are at increased risk of infections. And in fact, the reason that a lot of vasculitis patients, a lot of reasons for their for issues and for death is because of infection. It's not from the vasculitis in that first year. So you really do need to protect yourself from infections.